So our next presenter is going to be John Kaiser, and he's going to take us through more of the details of Medicare Advantage and Medicare supplemental plans. John?
Okay, I'll get started here. Sorry for the technical difficulties. You're dealing with someone who's not that technically qualified these days as I age. I mentioned I'm going to try to walk you through an understanding of Advantage plans versus Medigap plans. But first, some general rules. Medicare, as you know, covers 80% of your approved amounts for the hospital doctor service, and that's at participating hospitals and doctors. The Medicare and You booklet that Paul mentioned, it just came out, that details covered services. That's a very important statement because when I first went on Medicare, I got a policy. I wondered, where's the detail? Well, the detail of what's covered is in this Medicare and You book. So if it's covered by Medicare, then these supplemental insurances, whether it be an Advantage plan or a Medigap plan, they cover what's in that booklet. And in order to cover the remaining 20%, we've got Advantage plans and we got Medigap plans. With a Medigap plan, you also need a Part D drug coverage. What I've written is a detailed document titled Understanding Advantage Plans, Medigap Plan, and that's on the website. So while there's going to be a video of me speaking here, I would recommend you go to the document. It's quite detailed. It's even more detailed than what I'm going to say today. For 2026, Medicare's deductible for Part A services is estimated to going up to $1,716 for each benefit period. By each benefit period, that means each time you would go back into the hospital for another event. So that's significant. And for Part B services, there's an annual deductible of $288. Now, these amounts are in addition to the monthly premium you pay of $206.50, which Paul mentioned. That's the deduction that comes out of your Social Security if you're enrolled. If you're not enrolled, it's a direct pay. Also, if you have higher income, you're going to get hit with a higher amount than $206.50. High enough income, you could be paying $400 and some a piece. So that is determined by your income. And I think the base was 106 for single and double that, 212 for married. So anything above that, you're going to pay more than $206.50. That should make you aware of that. The type of plan and the coverage that you get determines your Part A and your Part B deductibles. If Medicare covers a service, then a Medicare Advantage plan can provide 100% coverage because now you've shifted everything to this insurance company with that plan, or a Medigap plan, which covers the 20% because you're still on original Medicare, which is covering the 80%. It's not necessary for spouses to have the same insurer, but generally if you do, there's a discount, or even if you're have someone living with you, there's a discount. So that's important to note. But again, you should go with whatever plan suits your needs. MA plans, Advantage plans, and Medigap plans do not cover assisted living or long-term care. MA plans are an insurance plan separate from Medicare, so you're not covered under original Medicare anymore. Everything's been assigned over to an insurance company 100%. However, there are no pre-existing condition limitations. You're accepted regardless of health. Out there now, which have become very attractive, are zero premium plans. But they have deductibles, co-pays, out-of-pocket maximums, and they'll vary with the specific plans. And I'm going to give you more detail on that later in this presentation. But noteworthy is the Medicare Part A deductible of $1,716 is not covered under an Advantage plan. Most Medigap plans do. I'll get to that. Most Advantage plans today include coverage for Part D drugs. You probably wouldn't get a plan without the Part D coverage. And most plans now also include coverage for dental, vision, and hearing options. And there's even an allowance or reduced costs, with an allowance or reduced costs at network providers. Many also are offering free gym memberships. Not everyone's using them, but they're offering them. Or an out-of-pocket allowance for over-the-counter medical supplies like aspirin and other non-prescription items. With an Advantage plan, you can choose based on the type of healthcare services you need. The premium amount is not based on age, sex, zip code, or your health condition. However, out of state can mean you're out of network, but even now, that's not true for all plans. That's what you'd have to investigate. For example, if you're in Florida part of the year. Some newer plans charge the same both in and out of network. A good example of that is the United Healthcare plan. These plans can include free in-home care and other benefits if you are eligible and your doctor approves. But that's pretty much generally for people with very low income, so that you may not qualify for that. If you initially enroll in an MA plan, you got 12 months to change your mind and go back to original Medicare and a Medigap plan with no underwriting. I'll explain underwriting in a little bit, but that's important. You got 12 months. So if you said, okay, I want to try this out, you do have 12 months to go back.
John, it's really important to note that's only at 65, no other age.
Okay, thanks, Laura.
You're welcome.
You can join or change or cancel MA plans during the annual election period, which is October 15th to December 7th of each year. However, you can also change or cancel an Advantage plan during the open enrollment period of January 1st to March 31st, but you cannot enroll at that time. With an Advantage plan, you will receive only one billing from the insurer, none from Medicare, and you also still pay that monthly Medicare premium of $206.50 we mentioned. There's different plans, different choices. An HMO plan can be the least cost plan, but will limit you on the number of providers. HMO point of service plan is like an HMO plan, except you can be seen by a provider outside your network, but you would pay more. A PPO plan, preferred provider organization, has the most flexibility. You can go to any primary care doctor or specialist, but pay less in network. But again, some plans are not charging even out of network. This one, the PPO plan, is the most popular one that people choose. And if your insurer cancels your plan, you have 63 days of guaranteed issue, which means you could go enroll in a Medigap plan without going through underwriting, or you can even enroll in a new Advantage plan. However, in the past few years, MA plans become much more attractive to Medicare recipients, primarily because of the zero premiums and the other benefits like the dental, vision, and hearing. But recently, they've had problems with procedure approvals and with insurers, hospitals, and doctors even dropping the MA plans. So that's an important consideration, and you've probably heard more about that in the news, but that is a consideration. This chart shows you the popularity of the Advantage plans. It's how it's grown over the years. And I think that's driven by the premium costs and all the benefits. I suspect that line may flatten out because of some of the concerns. But now I want to talk a little bit about Medigap plans. That's a private plan, but that's designed to cover the 20% balance that was not paid by Medicare. So 80% Medicare, 20% covered by this plan. That deductible I talked about for Medicare Part A of $1,716, that's covered. That's covered with the plan. The Medicare Part B deductible, though, is not covered. The exception is the F plan, and I guess I'll deal with it here. F plan is only eligible as someone who was 65 as of January 1st, 2020. Now, if you're in a different plan and you wanted to go to an F plan, if you were 65 before January 1st of 2020, you could do that. You should not do that because an F plan has become extremely expensive. The reason it's become expensive because there's no new young people able to join it. And what you've got is people who are aging and using more health care. And so those plans have become quite expensive. And it's a problem for some who are in them because they can't get out because they can't pass underwriting. And that's an example of someone who may go to an Advantage plan only because the premiums are so high on their F plan. At age 65, when you're first eligible to enroll, you have guaranteed issue, meaning there's no pre-existing conditions involved. So regardless of health, you're eligible to enroll. That's why it's important that you do it at age 65 or when you're first eligible. By first eligible, they mean, let's say your spouse are still working and you've got that coverage. You don't have to, as Paul mentioned, you don't have to sign up at age 65. After your initial enrollment in a Medigap plan, you do have 6 months to change Medigap plans, again, with guaranteed issue, no underwriting. Unless you enroll at age 65 when you're first ineligible, the insurer may deny you coverage or charge a higher premium due to your pre-existing conditions. So you may not even be able to enroll at all. Continuing, so medical underwriting is a review of your medical history. It involves a series of medical questions, including the discussion of the prescription drugs you take and why. So when you call out a particular prescription, that leads the question, well, why are you on that prescription? For example, some kind of heart medicine, that's going to provoke questions about your heart. And there's going to be certain things about your heart. If you're, maybe you just had open heart surgery or something, you're going to find that you cannot get a Medigap plan, again, unless you've gotten it when you're initially enrolling. I'm repeating myself, certain conditions related to the heart, cancers, etc., and pending or recent surgeries can disqualify you. So whenever you first start on Medicare, you have guaranteed issue. It is possible to enroll in a Medigap plan by paying a higher premium due to certain conditions, for example, smoking. Medigap plans have no open enrollment restrictions. Unlike an Advantage plan, you can change the plan at any time. The problem is if your health deteriorates, you may not be able to pass this underwriting. Medigap plan coverage is determined by plan codes, which are standardized among insurers, as Paul mentioned. The plan you choose will determine your premium. The most popular plan is the G plan. There are no further costs after paying the Part B deductible. The premiums are higher than MA plans and can vary greatly by geographic area. Best example in Michigan, if you were in northern Michigan, you'd pay more than if you were down in the metropolitan area. That's the area I'm familiar with. Unlike Advantage plan, Medigap premiums are based on age, sex, tobacco use, zip code, and county, and your health. After initial enrollment, if you're changing a plan. Medigap plans do not cover dental, vision, or hearing. They do cover skilled nursing if you meet certain requirements. They cover many procedures when MA plan, Advantage plan would have copays. I'll show you some of that in a bit. This is a chart similar to Paul's, same idea. Well, you can see the F plan is, the reason it's in red is it's no longer available. Actually, C and D are no longer available either. The G plan being the most popular, you can see the coverage there. Another alternative is an N plan on the far right. The difference between the N and the G is that you'd pay $20 an office visit and $50 for an emergency room visit. That's an alternative if you don't see the doctor a lot because there's a savings in the premium. One issue would be, though, if you started seeing the doctor a lot of office visits, then you'd have to pass underwriting to go from N to G. But again, the G is the most popular plan and the F is not available unless you were age 65 as of January 1st of 2020. Most states allow you to roll or change Medicaps at any time. However, if you're in an MA plan, switching to a Medigap plan, make sure you're eligible to make the change under the 12-month rule or you're going to face underwriting, as I previously mentioned. And this is bolded because it's so important. Never cancel an existing policy without written proof of your new policy from the insurer. There's time to cancel the old one as far as the premium, but you've got to make sure you've got written proof of your new policy. You don't want to get caught with no plan. Medigap plans do not cover drugs, Part D drugs, and when you enroll in a Medigap plan, you must sign up separately for a Medicare Part D. Several Medigap plans do cover foreign travel with a 20% copay. Most MA plans do not, but may cover for emergencies with a copay. Now, I've tried to do two charts that compare Medicare Advantage plan using the ARP United Healthcare plan to a Medigap G plan. And it's kind of difficult to calculate the dollar differences because of the variables, but you'll see the difference in the coverage when I show you the charts. Everyone has different circumstances in terms of health and affordability, as well as comfort level. So on the left here at the top, you see the Medicare Advantage plan using United Healthcare. I say ARP, but I should say United Healthcare. And on the right is a Medigap plan using G, and that's also a United Healthcare plan. So the annual premium is, in this example, is 0 for an Advantage plan. I give a range here for the G plan. That's a male. I should have had the word male in there, but so you're looking at 120 a month at 65, you're looking at 288. And as Paul showed you, there's a whole range, but you can get a plan certainly at these rates. Part A, medical deductible for hospitalization. You will pay that under an Advantage plan. It's covered under a Medigap plan. The Medicare deductible is included in an Advantage plan with your copays. However, with a Medigap plan, and the plan G is the best example, which I'm using, you're going to pay $288 up front. So the first $288 you spend in the calendar year, you'll pay, and after that, you don't pay anything for coverage. The drug premium is included with an Advantage plan. The Medigap plan, the average they use is $38.99, but you'll find plans much less than that. I have a 0 Part D plan, so there's a whole range of prices there, but the average is $38.99. And in both cases, if you get drugs above tier 2, which I will explain what those tiers are later, but those are primarily brand drugs, you're going to have an upfront deductible of $615 each year, which counts towards your maximum drug cost that's gone from $2,000 up to now $2,100 for next year. So once you've spent $2,100 on your drugs, which is the premium and the deductible, not the, which is the drug cost and deductible, not the premium, then your drugs are free for the year. I'll say more about that after the break. In terms of network, your participating doctor can be out of network in this plan, but some plans you need to be in network or you're going to pay extra. That's not the case with a Medigap plan. Any doctor accepting Medicare, there are no networks, and pretty much every doctor is accepting Medicare. With a Advantage plan, the max out of pocket has gone up the last 2 years. It's now at $6,700. So once you're under an Advantage plan, you've spent $6,700, which is a lot, but that could happen if you have a lot, say you have a lot of hospitalization. Everything's free, there's no copays. But in the case of a Medigap plan, because you are paying that premium, there's no out-of-pocket limit. It's not capped at all. And the next page of this gives you some more detail about copays. A specialist, a primary doctor is covered, and of course it's covered on a Medigap plan. I won't go through each one, but you can see, for example, you do need prior authorization on some services. You don't need that with a Medigap plan, although they're testing that in a couple states. But that prior authorization is kind of important because that's been the issue lately where people are getting denied authorization to get other services. Diagnostic tests have a range of price. They're all covered under a GAP plan. Again, outpatient x-rays, therapeutic x-rays, physical therapy, which is the one Paul mentioned. And this plan has a $25 copay each time you go for PT. whereas with a Medigap plan, it's all covered. So you can see going down the list, you've got co-pays with Advantage plans, you don't with a Medigap plan. But the big benefit that a lot of people like is that you see down below is the dental, the vision, and the hearing, gym membership, and over-the-counter spending. None of that's covered with a Medigap plan. So I'm open for questions, or if you got a question later in the presentation, not too late, I will comment that again, that there's a document that's going to be online that, hell, it's 14 pages long, that covers this in even more detail than I just took you through.